Hello, my name is INFM, and this is going to be my capstone project for Informatics 700, titled Pharmacovigilance Analysis of Drug-Drug Interactions in the FDA Adverse Event Reporting System, a Retrospective Study. In the introduction, I present adverse events which affects the quality and safety of patient care. These are typically due to medication errors, healthcare-associated infections, unsafe medical practices and procedures, or even diagnostic errors. Medication error is defined as the preventable event that involves medication use that may result in patient harm at any point of the medication use processes. More than 100,000 reported cases have been received relating to medication errors. One type of medication error is drug interaction. There are three different types of drug interactions, including drug-drug interaction, drug-disease interaction, as well as drug and food interaction. Drug-drug interactions are the most common. The risk factors for these include comorbidities, polypharmacy, increased age, and cardiovascular medication usage. There are current strategies that are used today that are implemented into clinical settings that prevent these drug-drug interactions from occurring, including EHR implementation, use of alerting and reporting systems. Pharmacovigilance is defined as the process of understanding drug-related problems to prevent drug adverse events. The FDA has created this system or database that is publicly accessible that is used by healthcare professionals, patients, and manufacturers to report issues with medications. For this study, our hypothesis is if medication errors reported to the FDA Adverse Event Reporting System happened in the years of 2017 to 2019 and is labeled as potential drug-drug interaction, then the use of pharmacovigilance can estimate the prevalent rate of drug-drug interactions globally. The aim of the study is to create awareness of the negative impact that drug-drug interactions have on patient care, and the objective is to analyze and assess drug-drug interactions in the various databases to determine the trends and correlations in the prevalence of demographic characteristics and risk factors, as well as the drug classes and frequencies. The study presented today is a correlational descriptive research retrospectively assessing drug-drug interaction cases over a period of 3 years from 2017 to 2019, populated in the FDA's Adverse Event Reporting System, also known as FAERS. The data collection uses key terms such as labeled drug-drug interactions, limiting to the years of 2017, 2018, and 2019, only looking at the serious cases which involves hospitalization or death as the outcome. Data retrieval included 54 serious cases with finalized 38 cases of removal of duplicate cases, and the information provided by FAERS included the product name, drug classes, event date, and the patient's sex and age. For the statistical analysis, we'll be using Microsoft Excel to create charts, tables, and analyze data to determine correlations. From the FAERS, a total of 38 severe cases, including 44 drug-drug interactions, were evaluated. There are 5 cases that involved more than one interaction. Discrepancies between the databases, including Lexicomp and Micromedics, were reviewed. Of the 44 interactions, Lexicomp has identified 11 contraindicated interactions, while Micromedics only classified 4 interactions as contraindicated. From the 33 interactions that both databases can classify, there is a 52% difference in the severity rating between the two databases. For the demographics, there were more females reported in the cases, and 2.6% were unspecified. 50% came from the United States. The ages were leaning more towards those who are older or equal to 65 years of age. However, we do want to make note that 21% of the cases, they didn't specify the ages. So the date of occurrences, there were more in 2017 and 2018. 2019 only had 13% of the cases, but this could be due to the fact that the reports weren't going through. So maybe by the end of 2020, there'll be more 2019 reports. The commonly involved drug classes the top ones were the anti-neoplastic agents, antiplatelets, antihypertensive, anticoagulants, and the drug that was commonly involved in these interactions was aspirin, being involved in 9 of the cases, which is 20%. So then we can see on the right, I included the chart where it shows the percentage of each agent that were involved in the interactions. So overall, the study aimed to retrospectively analyze and assess the drug-drug interactions in the web-based, publicly available FAERS database. With the secondary data provided by the FAERS database, the populated cases were limited to those that occurred in the years of 2017, 2018, and 2019. Although most of the severe reported cases seems to be related or rated moderate to severe, the outcomes of these cases were either hospitalization or death. The severity ranking between the two drug information databases showed conflicting rankings for a numerous amount of interactions. The professional judgment determined by the healthcare professionals incorporating in the specific patient care should also be considered. A study done in 2012 showed that drug-drug interactions are typically overinterpreted by the drug information databases compared to the healthcare professional judgment. In a previous study, these databases typically overanalyzed the interaction, thus the clinicians and pharmacists involved in the study had a better understanding of the patient's medical situation and drug therapy. The risk factors for drug-drug interactions and error-related adverse drug reactions are the numbers of medication used by the patient, increasing age, and the use of anticoagulant therapies. In this study, those who were age 65 or greater were involved in a greater percentage of the reported cases. The polypharmacy could not have been assessed due to the limited data that the FAERS databases provide. In this study, antiplatelet agents were involved in 10% of the reported cases. In support of the previous studies, this study presents anticoagulant use is involved in a greater percentage than other drug classes. There were also less reported cases that occurred in 2019, which may be due to the unreported cases. However, by the end of 2020, there may be more reported 2019 cases. The use of electronic health records with the implementation of clinical decision support system is a strategy used in the healthcare facility to detect and prevent medication errors, including drug-drug interactions. The major concern for these alerts is alert fatigue. It is imperative that healthcare facilities that implement alert system needs to consider pharmacovigilance and differentiate the more severe interactions from the non-severe interactions. As for the limitation, due to the use of public reporting database, the consideration of underreporting is a limitation when interpreting the data. The study retrospective study design, which prevented real-time feedback from the healthcare professionals and patients involved in the cases. The correlational relationship established were limited to the information provided by the FAERS database. There was no access to the respective EHRs for each case to complete analysis of the drug-drug interactions and the medication profile. Since the study was retrospectively performed, certain drugs involved in the study were identified with multiple drug classes, which were not considered in the results. Only 2 drug information databases were also used in the study. As for the conclusion, overall the study has assessed drug-drug interactions, labeled cases from the FDA Adverse Events Reporting System. The comparison between the Micromedics and Lexicomp databases show that although both resources are evidence-based, there are conflicting results in the analyzed drug-drug interactions. The results have provided baseline information about the prevalence and correlational relationship of drug-drug interactions between age groups, sexes, and therapeutic drug classes. The study supports the idea of pharmacovigilance in improving or enhancing information and technology incorporated into the healthcare workflow, such as clinical decision support systems or electronic health records. The study focuses on the aspects of improving patient care by optimizing drugs and medications for the treatment and avoiding undesirable effects, including medication errors. The data obtained from this study will bring awareness to the prevalence of drug-drug interactions globally and will be useful in the development of future and extensive adverse drug reaction monitoring and alerting programs in the clinical setting. Here are the references. Thank you.